Yeah,
Am I still a
your,
gremlin?
no, your ears aren't poking out now.
Gremlin.
Well, your ears are poking straight out sideways.
It helps me hear.
No.
Syndrome.
3 minutes. Is it 10?
It is.
Ready?
Yes, sir.
Call the meeting Crawford County Commission to order July 7th, 2020. Begin with the flag salute. I
Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
All right, I guess you had a chance to look over previous meeting minutes. Any changes?
Mr. Chairman, I'll move we accept the minutes from the previous meeting.
Second.
Aye. And signing the motions, we only have 3.
We have 3 motions from the last meeting to sign. This first motion is 20-267, that the consent agenda be approved. The second motion is 20-268, to approve the tax roll correction correcting an error in the assessing of personal property owned by Gerald W. Goble, and to request an abatement in the amount of $34.06 from the 2016 tax rolls, $30 from the 2017 tax rolls, and $30 from the 2018 tax rolls, and authorize the chairman to sign. motion is 20-269 to adopt resolution number 2020-011, a resolution regarding the Spark Task Force proposal.
Thank you.
Thank you, Donald.
Thank you, Commissioners.
Okay, I know we're gonna have a long day, so do you want to start with Safe House?
Yes.
Just because I don't feel it's fair to break this out. Yes. Yeah, Jim's. Good morning.
Morning.
My name is Brooke Powell, and I'm the Executive Director with Safe House. And we are currently working on applying for ESG funds. And ESG funds are temporary emergency shelter. When victims in our communities flee domestic violence, sexual violence, stalking, and human trafficking, we can house them in our emergency shelter to help them, once they're safe, then help them rebuild their lives free of violence. So ESG funds are really vital in us continuing to keep our shelter doors open. It pays for the utilities in our shelter and also some of the staff that work in our shelter. And this year, we have had an increase for this funding application to help us during COVID and making sure that we have other resources for these clients fleeing violence in case shelter isn't an option for them. So I've sent that to you, and I'm hoping that you guys will approve that.
Jim?
So on everybody's desk is a packet for the emergency shelter grant this year. As you can see, it's a lot higher than we've had in the past. Just some extra money to all.
Yes.
So it's $44,100. The packet then, you can do all this in one motion, contractual. We've been doing this since I've been here, so that's 95. I've been helping to work on this, so I've seen these documents that time. Provision, the grant award conditions, you do get audited. Not really audited, I guess, but they sit down and go through our books and books every 4 or 5 years, make sure we have all this in place. So that's the conditions. We also, then the budget. The budget shows $42,000, the rest of it's in administration, so you can get the end. That is the essential services, prevention piece, we're just talking about utilities, random security deposits, rental assistance. Then as you flip through, I'll do this a little bit quickly. There's a faith-based agency certification that we had to put in 3 or 4 years ago. Under the previous administration, we have to make sure that that's not applicable to this survey, so it's not applicable. Then the last few years, we've got an environmental review. We're not in any airway. Once you get that from the city, we're not sheltered out of FEMA area. We get that from the FEMA flood map. So you see the airway, the airport there, then the flood, the FEMA map. Starting about 2 or 3 years ago, we had to add in our county's workforce free policy or workplace and conflict of interest policy. So they do ask, as time goes on, they ask for more documents. But really, the county is involved because, say, if I was county plot on the road, they have to apply to the city or county. So it's applied to Crawford County for several years.
Yeah.
Yeah.
All right,
It's
very
really
good.
just a pass through.
Very good.
And it looks like it's more.
It is more, it's normally around 23,
That's
24.
what I thought. Well, that's good news.
Yes.
Do you anticipate what the additional funds, how those will be directed as opposed to how they were before?
Sure. We've always ran pretty short. We run out of the utility funds about January of the year. So halfway through the year, we have to find funds for utilities somewhere else. So that will actually cover, hopefully, our utilities this year. And then what we've also done with the extra funding is potentially having funding to keep clients in their own homes, if that's an option, by helping them get caught up on back bills, back rent, utilities, and also having funds to potentially put them in hotels, if that's an option. That has been an option we've had to utilize because of COVID concerns and maybe health issues of a client. And so that hotel funding will be really, really important. And then also helping clients get into their new homes by helping them pay first month's rent or utility deposits and things like that.
Well,
Very cool.
appreciate everything you do.
Thank
Yeah.
you.
Have a nice operation.
Do you have any questions?
I don't think so. I will move to approve the ESG grant.
Authorizing the chair to sign.
The chair sign.
Second.
All right. How many you need?
Two of those signed.
How many?
Just two.
I can check these after the meeting. Jim, make sure I have everything.
Thank you.
Thank you.
Not sure how much is. All right. Yes. Is there anyone else that needs, unless you want to be here for a while? If you're here for the COVID discussion, that's great. I'll try to run anybody off. If you're here for something else that you'd like to go through first, we give you the opportunity. Okay, so I guess we're gonna take up where we left off in our work session.
Yes,
Do
let's
that first.
start with Rebecca and kind of give us an update where we're at, and then we'll discuss with our doctors to see what direction we need to go.
All right, so as you probably already know, KDHE updates the state map by county every Monday, Wednesday, and Friday. So as of yesterday, we had 278 cases in Crawford County. And I will say, we've had some positives this morning, so that number changes every day, but they only update it Monday, Wednesday, and Friday. So we are still doing our contact investigation, contact tracing, disease investigation. So I don't know if you want me to go over the request for the disease investigation epi nurses at this point. Okay.
can.
So we would like to advertise for 3 additional disease investigation, or what we call epi nurses, they would be contract temporary workers, nurses, to help us with our contact investigation. That way we can do more of the contact investigation locally rather than having to push many cases out to the state. That will just give us a better continuum of care and a better understanding and kind of a unified message that everybody's getting the same information. It will make it simpler. And then I would also like to advertise for a contract nurse practitioner to start that process of looking for someone to assist in the future with COVID-19. Also in the clinic, we have a clinic that we could see patients and screen patients for COVID-19. And as we transition forward with our different positions of health officer, deputy health officer, that person could also possibly play a role in the future in that respect, just depending on what the future holds. That's unknown at this point. So I would just like permission to advertise for those 4 things. And then we also discussed getting 2 rapid testing machines in the county. And I would like permission to go ahead and work with the Via Christi Lab to order those 2 rapid testing machines, one for the Community Health Center and one for the Via Christi Lab, as well as the supplies.
Jim, do we need a motion on this?
Yes.
And before we do the motion, just to clarify, nurse practitioner, we talked about that before.
Yes.
I mean, it kind of evolved in the COVID-19
It has,
discussion, but it's
yeah.
not directly a response to that, something that.
It would not be, about
Right,
50,
we could-
about 50% of that person's time would be directed toward COVID-19. So
And then the epi nurses is a response.
that is
to-
100%. So the
COVID-19
nurse
situation.
practitioner would be 50%. I can put an ad in for a part-time nurse
No,
practitioner.
no, that's fine, I'm just
Either way.
clarifying, because.
Yes, that's
People didn't
correct.
get to see what we talked about
Right,
before, it
we'll
kind of got.
be able
Right,
to
yeah, it's kinda
Utilize that
hard to catch
person
up.
in other manners
Right.
once we get.
It'd be
through
about a
this pandemic.
50/50, 50% COVID-19, 50% other county-related work at the health department,
And then
seeing
the-
patients.
And then the rapid testing is so we can get quicker turnaround on our test results, because 10 days is.
Yeah, we've had some
absolutely
tests
insane.
taking, I mean, probably most are 4 to 5, but
Right, but.
we've actually had some tests take 10 days, and by that
Which
time,
is
like,
unacceptable.
yeah. And as cases spike, not just in Kansas, but throughout the country, commercial labs become more and more inundated. And so they're not just getting test samples from Crawford County, they're getting them from, I mean, other states even, not just Kansas. So it's important that one of the 4, criteria we need to meet are the ability to test quickly. Those machines would help us to meet that metric. Reducing deaths, being able to isolate and quarantine. The 3 epi nurses would help us to be able to do that more quickly, contact, trace, and isolate and quarantine. So, we need to be able to meet those metrics, and these measures would help
Well,
us in all of
The turnaround of
that.
testing would help with contact tracing.
Oh, absolutely.
substantially.
If we could have it within a day,
Yeah.
we could know immediately who those contacts are within 24 to 48 hours, rather than,
Minimize the
10 days.
the medical and economic impacts. of the community
Right.
yes.
By rapid testing and rapid isolation and quarantine, prevention of further spread.
And then we
Yeah.
also discussed earlier, the rapid testing is a benefit long-term, not just COVID-19 related,
Right.
which.
And the reason we're asking for 2 is that if we start testing large numbers, it will be no different than sending it to a lab where there's a lot of samples to be run. One lab can only do so much with so many staff members. So we'd like to have it at 2 locations. That way, we can just maximize the ability to test more folks faster if we need to.
Okay. Thanks for clarification.
Sure.
Just-
Yeah.
Rebecca, do you want to talk about how communication has been going between now that some of our contact tracing has been outsourced to the state? what that
Yeah,
looks
so it
like?
just adds another layer of communication. So rather than, me and my epi nurses just talking we kind of have like what we call our war room. It's a big conference room where we have all our computers set up, and that's what we do all day long, is call people all day long. So they have questions, they can just ask me right there. But when you put in another person, like up at the state, they've been excellent. I just want to throw that out there. They've been very helpful. It's just difficult because then you've got to call that person and talk to them maybe about the case, because they've talked to the case already. So it just adds another layer of communication where gaps can work in. And then, everybody has their interview style, and they've been trained by the state. We've been trained by the state as well, but every county can kind of there's little caveats that we can do things a little differently if we need to. We can make decisions with our local health officers. They have the authority if we need to do a modified quarantine, where up at the state, they're just kind of, doing the interview, sending out a letter. And there's always a lot of questions by the people who are positive or who are contacts. It would just be much easier if we could keep it a little bit more consistent. We get a lot of calls saying, I talked to KDHE, this is what they told me, is this what I should do? So it would just take out the middleman, really, and make it much easier and more consistent for our citizens, and more and rapid. It would be faster as well.
Do we still have contact tracing happening at the state level right now?
We do. We still have some of that going on. Just getting caught up from our large outbreak has taken weeks. So, because when you think about it, say a person's positive, so they're in isolation for 10 days. Anybody in their family also has to stay in isolation with them for 10 days. We call it quarantine if they're not sick. But they stay in those 10 days because that's how long the person is contagious. Then the family members stay another 14 days in quarantine because the incubation time period for the virus is 14 days. So people can be in quarantine for 24 days if they actually live with someone who's positive. So this can take weeks to get hundreds of people out of quarantine. And that we're on the tail end of that with our spike. So I'm hopeful that by next week, or maybe the week after, if we get additional help, depending on how long it takes to get some extra nurses, we could just start taking all of our own cases back, which would be much, much faster and more efficient.
Well, I know too that I've heard some confusion about where to look for that information, which I sense is partly because we've outsourced some of it, but
For
also,
isolation and quarantine, you mean, or?
well, just in terms of like the number of cases and that kind of information that at one point we were putting out and now.
Oh,
is
yeah,
that
I
still
mean,
the case,
it would take hours to go through the online system to figure out exactly how many people are in quarantine. I mean, we could work with KDHE to try to run a report, but it gets very confusing when you've got one entity doing part of your investigating and another entity doing the other part. It becomes, and that's why we would like for people to follow the state map, because those numbers, they will fluctuate because addresses are still sometimes getting put in under the wrong county. But after a few days, they are correct. With the spike, it fluctuated a lot because we had a lot of out of state. Some were assigned to us that weren't us. So overall, the state map is pretty. It's good. I don't think we need to split hairs over, well, is it one or two off? It's pretty accurate most times. It might fluctuate a little because of addresses, but the information is there on the state website. And we do get a lot of questions at the health department, how many are in quarantine? Well, that number is not as important as people just realizing we have COVID-19 in our community. You need to take the measures to protect yourself because it is here. So the number of folks in quarantine is not going to it's not going to change anything that we do. And we work with law enforcement and healthcare and all of our partners that we need to work with to ensure that first responders are safe. We're following all of the statutes to ensure that. So the general public just needs to assume it's here. There's people asymptomatic that have tested positive. You need to take the precautions to protect yourself.
I will tell you, with respect to isolation and quarantine, there's a lot of misunderstanding related to what those terms actually mean and what they actually do. In isolation, that means the patient is infected, they're positive, we are isolating them from everybody, as many as we can, and the public. So quarantine is those that have been exposed, and that 14 days quarantine gives us time to ensure that they didn't pick up from a close contact COVID-19 where they're going to become symptomatic and then spread. There's a lot of, the misunderstanding goes deep enough that even on the news, I hear those terms interchanged where they're talking about isolated patients and then saying that the other number is released from quarantine, and they're two different population pools. And so it might be helpful for you guys to know how many we've had isolation and how many are released from isolation. That number might give you a better understanding as far as how many are left with the active disease process. The number of quarantine is going to fluctuate so much daily.
Yeah.
I don't know that it's valuable to put RIV nurses on that number versus contact tracing, right?
Yeah.
And so, and then, the case number is important for us so that we can follow new cases day to day and doubling time. And that gives you a better idea of the impact on the community. So if we're going up by hundreds, that's much different than if we're going up by ones or even tens, quite frankly.
Right.
And so those numbers are more important for you and the public to understand kind of where we're at in this, in the process currently in our county.
And the quarantine numbers are only as accurate as that follow-up survey and who they disclose they were
Yeah,
around.
absolutely.
That's
And it
absolutely.
fluctuates. I mean, sometimes we'll get a call the very next day, oh, I forgot somebody, you know?
Right.
It fluctuates every
Or they
day.
try to protect somebody.
It happens.
that have been tested should generally quarantine.
Yes.
and get their test results back.
Right.
So that
That's confusing. Once you're tested,
You
you're a
definitely
person under
skewed the numbers,
investigation. Yeah. So actually, once you're tested, you're in isolation.
Right.
So once you're a PUI, you're in isolation. And I always say I for ill, isolation. So that's easy to remember. We posted on the website yesterday the definition of social distancing, isolation, and quarantine, and on Facebook, so that might help. But, you know, yeah, so it does get confusing. And I will say from our large outbreak that we had several weeks ago, you know, it's a 10-day minimum isolation. All of those folks are out of isolation now, all of those. I don't have the exact number, but there were, how many did we have from that large outbreak? Like 100 and, yeah, 160. In the county, yeah, like in the county. So a large portion. Right, a large portion of our isolation or positive cases are out of isolation. Of course, we're getting new cases every day, but our isolation numbers are going down, so that's good.
Yes.
I think there's a general thing that kind of ties this all together too, and we talked in our work session about a communications person on behalf of the county. And trying to disseminate all this information while they're attending to medical tasks and medical issues is just overwhelming. And so anything we can do to get information out to businesses, to the universities, to schools, to the community at large, and make that a coordinated effort on behalf of the county, I think would be really helpful. So that's one of the things we discussed in our work session today, and I'd like to bring that forward as part of the motion if we can too.
Yeah, as to request that we could maybe advertise for that person as well. If we had a communication, someone just devoted to pandemic county communications, they could, you know, that we can get them access to be able to run reports and run numbers and things like that, but there's just no way epi nurses or myself have time to sit for hours and run. I mean, these reports take hours to run.
Mhm.
So it really is a very time-consuming, it's important work, don't get me wrong, it's very important. And I know people want the information, but there's just so much capacity that we have.
And understanding that there's day-to-day change and information that we need to get out rapidly to prevent further spread, having a communications person that we could go to or go through to get that done, and that could be used for multi-county
Yes.
responses for, you know, all the different departments. Right now, highlighted the health department, but that would give us an advantage on protecting the public.
I think it's important too to just point out, we're looking to the spark money to help fund that position.
Right.
I would, just because, like, there are needs I think we know that we need to cover, right? Like a lot of what you guys at the health department have been scrambling to do. But I also think in the discussion with the recovery task force, there were, I think namely the PR folks at the city of Pittsburgh and PSU that wanted to put together a list of things they would like to see for like their purpose, like what this position should be doing, not just Facebook posts and press releases, but also like
Yeah.
maybe building some infrastructure on our end, whether that's running and managing a Facebook page, whether it's building something that we don't have already.
Well, absolutely. I mean, I think this person should be, if you're going to write they need a job description, so somebody will have to come up with that. But this person really needs to be the hub, the center of communications for the entire county. So they would need to be holding meetings with all of those people that you just said, like with county partners, with everyone. They would need to be coordinating with like the PIOs from all of those different entities within the county, with all the municipalities. So any job description you do come up with, they need to be pretty much the hub of information going out to all the entities, and they would be needing to meet with those people probably at least once a week, if not more.
Yes.
Because everyone, that's the problem right now, is nobody really has time to meet with all of these different entities to get all their information and then put all that out and put out all of our own county information. So absolutely, they need to work with every single person in the county that needs help.
So would it maybe
communicating.
make sense to hold off on that one to get maybe a more, because it sounds like with the LPN and the epi nurses, we know what.
You mean the nurse
job description
practitioner?
is gonna- Or the
Nurse
nurse practitioner,
practitioner, yeah.
yes. We know what that job.
Oh, yeah,
description
we have job descriptions for that.
Whereas the other one, we maybe need to figure out.
Well, it's just
before.
that you're going to have to go through a hiring process, which can take weeks. And sometimes if a person already has a job, then they have to give a 2-week notice, sometimes a 4-week notice. So that's the only reason for going ahead and collecting resumes, just to get the process started. And then, developing a job description, working with those other entities. But to me, getting the process started would be advantageous because it can take, just having hired people before, it can take months sometimes to really get the right person.
She's saying we'd like to see the county get a public information officer as quick as possible.
Yeah.
We would utilize them as soon as you.
Right.
Yeah,
I
yeah.
agree with you. We need to do this.
And if you get an experienced PIO, and I am a PIO, but I don't have the time to do this, all of the work so that everybody gets it. But if you get an experienced PIO, they should be able to just hit the ground running. I mean, they know their job, and you can put the job description forward for them. And I will say too, that will change as we go. There was no way we'll know to include every little thing. So we could work on a job description for 3 or 4 months and still something would change like the next day because
Right.
a new situation would arise. So, but I think the sooner the better.
Yeah, I agree with you. The task force that you're referring to, I don't even know who's on it. Bruce, do you have any idea who's on it? No. And I would like a list of who's on this task force before they make contact with any of our organizations, county groups, cities, because from my understanding, you were called on Wednesday after the Tuesday meeting.
We just have a healthcare call every Monday, Wednesday, and Friday at 8. Dr. Stebbins is on those. And I've worked with the task force. We've been working with the task force. So the discussion just came up, who do we send our budgets to? So we were going to email them to the task force, but then just Monday, the discussion came up again. No, we're just going to bring those to the commissioners. So there hasn't been anything really set. I think there's just been some confusion around who do we give them to and what's the process. And I know you guys are still working on it.
And the task
We
force
just
is
didn't
just
know.
an advisory committee.
Right. So we just didn't know what to do,
Because
but,
the ultimate decision lies with this
Right.
commission because we're the ones that's on the hook for the money.
Right.
If it doesn't.
Just so that you understand, everybody understands that the commissioners are responsible for the Spark money and how that's going to be issued out based on the requirements of the county. I think, and Jeremy or Commissioner Johnson can.
You're good.
Yeah, can brief maybe more to this, but that commission is just set up to help get people organized to understand what the process is and to help you further. There is some challenges as far as how we're going to bring those forward to you. And I think you guys were going to discuss that today as far as the process that you're going to put in place to bring those requests forward for COVID-19 response. It is a large pool of money that's going to go very quickly, and I think we all understand that. And everybody just wants to make sure that those high priority needs are being addressed up front and that you have the appropriate information from each of the entities. And so I think they're trying to get ahead of the game, not get around you. And the healthcare calls that we have on Monday, Wednesday, and Friday are largely based on, or what our goal of that is to ensure that the healthcare organizations within the county are appropriately updated on what's going on currently and that we can meet the needs of our community. And so the majority of the calls related to that.
Like I said, I appreciate what they're doing to help, but we need to be kept in the loop, and that was my concern after I'd heard that Wednesday.
well, that's why I wanted to bring our budget to you, because I just didn't know the process yet. I just wanted to make sure that you have it.
And as we were discussing in the work session, You know, public health has been an area that has been grossly underfunded since its inception. We are there to provide rapid, there's a lot of things that the health department does that we don't ever see, right? They do a lot of things in the community for public health to keep people healthy and our communities healthy. One of their big things is response to pandemics and issues like this. That has been traditionally underfunded. And because it doesn't happen a lot, but it's here. And this is why we bring it forward to you today, because we're trying to manage the here and now with the staffing of yesterday, right? And it's not working. And we want to do well for our county. We want to do well for you. We just need a little help.
Sure.
And these things will help us.
Okay.
Any other questions?
Not at this time.
Then, Jim, can that all be one motion?
Yes.
I'll make a motion, we allow the health department to advertise for position of 3 epi nurses, 1 nurse practitioner, 1 PIO or communications officer. And be in touch with Via Christi over 2 rapid testing machines. And is that, and supplies. Will that work for now to get this ball rolling?
Did you get in there, Bruce, communications coordinator?
Mm-hmm. Yeah, the PIO.
Next motion?
Yep.
Second.
Aye. Hopefully that helps. I think the testing turnaround will help greatly. And then likewise, and to kind of, I don't know how this all meshes together, but we got some people from school districts here, and I know they've been in talks with each other. If those conversations are happening and they have a representative that can bring that total together, I think you're going to see a lot of your items and their items are similar, and we can just combine this order to make it where you deal with one company, so many items, maybe get a better warranty, and maybe a quicker turnaround. I don't know. Same with the cities, because whatever they're looking at, everybody needs similar stuff in this. You're a little bit specialized, but I can only imagine what the schools list is going to look like.
Yes, it's probably a good plan to go at it that way. That way everybody's on the same page.
Yeah, and everybody's involved, not left out. Okay, so where do you want to move from here? That was kind of our work session.
Dr. Stevens, did you have any other updates you wanted to give?
Sure.
Okay.
Rebecca already mentioned the current state of the county of 278 cases. That represents 15 increase from Friday. We know that there's going to be more. We do have some increase in both our north and southern counties in Bourbon and Cherokee. I think that's 35 and 40 respectively. Not huge outbreaks, but the numbers are spreading. We do know that across the border, Missouri, Jasper, McDonald, Newton counties have similar increased numbers that they're dealing with. Currently in the hospital, we have 1 positive and 4 under investigation. That was as of this morning. That may have changed. I believe Girard has 0 at this time. So medical impact on the community in that respect is not significant currently. So that's good. We are looking at a few new areas of concern related to healthcare providers getting ill, and we're managing that. I think we don't have significant numbers, but we have numbers, and so we're working with the appropriate organizations related to that. We are also working to move as much of our caseload that we can from KDHE back to us, so we have better control and understanding of the current environment, so we can present that to you and manage those cases in the community. The only other significant impact that we've had recently is the executive order from the governor that went in place last Friday morning at 0001, I think. And that's related to universal masking in the public. The health board has the requirement to adopt that or not. We strongly recommend masking. We have from the very get-go. Enforcement, we know, is going to be a challenge. We strongly recommend that all businesses require employees to wear a mask, and we recommend that they require patrons to wear a mask as well. We are trying to protect the public. It's a very small price to pay to do that. And you're protecting yourself and your family, right? And we're trying to decrease the outbreak as this goes. And masking can have a significant impact. I don't come at this from any political bias or reason. This is all related to science, current data, and common sense. And all of our decisions that we make are based on those three cornerstones: science, current data, and common sense, to prevent the impact on the public. And that's the medical impact and the economic impact. And we believe masks can have a significant slowing impact on COVID-19. And so our recommendation is that we highly recommend the use of masks. Whether you put that in full order, I'll leave to the health board, but that's our recommendation.
Is it required that we take action, or can we
You can just
simply
follow
allow
the-
the governor's order to stand here?
I believe you can just follow the governor's order and stand.
That's correct.
Yep. Many counties are debating whether they put this in place or not, and quite frankly, we believe, Dr. Green and I have discussed this quite a bit, there are some counties that have 0 cases. I don't know what impact are we making there? Probably not much. But here, we have 278 cases, and they're growing. And we're very close to a much larger population of COVID-19 positive persons, community. And so I think masks will help. Overall, what we don't want, again, is we don't want significant medical impact, and we don't want significant economic impact, right? That's as dangerous to people as the disease, right? And so wearing masks, I think, is a good way to go.
Doctor,
I've got agreement.
what, this could be an unfair question, but how long are you, I mean, is this something we'll look at every couple weeks, or?
Yeah, and I think that's part of the common sense approach to this, right? If we start moving into where the wave has left our region, I think we need to adjust how we manage this as well. And so looking at this, maybe not day to day, right? That would be too cumbersome, but week to week or weeks to weeks, I think is important for you to have that information to be able to make the best decision. And so I don't think this is a forever thing, for sure. Probably for several more weeks and maybe months, and maybe through the new year some, depending on how COVID responds through the summer and fall, especially with the other typical viruses that we would see. But yes, at least every few weeks to rediscuss this, to see where we're at, I think is important.
I just might add a little bit too. There are certain activities that mask wearing is really difficult, strenuous athletics and things like that. And, we are still advocating that we participate in as much normal life stuff as possible, and businesses able to stay open and activities being able to go on. And because some of those activities are going to be higher risk of transmission and you can't take the same precautions, we're not saying we don't want to participate in that stuff. We want to continue to do that stuff. We want our kids to continue to be in athletics and all of that. So if we are smart when we're outside of those activities and wear a mask when we go to Walmart and wear a mask when we go to other places, we can still reduce the transmission of the virus in the community and still be able to do all of the things like the fair and athletics and all of those things that we want to continue to do.
I guess this is a way to assure that.
Right.
It can help, absolutely.
That's what we're, every day as we look at this, that's what we're looking at. How do we continue life safely? How do we mitigate the risk, right? And every day, every one of us, that's what we need to do. What's our risk mitigation strategy for the day? Mask, hand washing, social distancing, right? And if there's a concern about contact, stay home, right? If you're a high-risk individual, right, probably going to the fair is not your best idea, right? And
Definitely if you're sick,
And definitely if you're sick.
don't go to work and don't go out and about.
But they, you know, we can still do things. We can still be a part of life. We can still have a lot of these things that we want to do. We just have to use the mitigation strategies.
And you ask how long we have to do this. I mean, we are learning more and more about appropriate treatments, and I think that's why we're seeing, you know, not as significant impact in the healthcare world that we did in some of the other communities on the coast early on, is because every day we are learning. We're learning little things that can help make the very critically ill survive. And the more that we learn, the better, you know, we will be moving towards this becoming something that is manageable. And we won't have to do all of this forever.
Okay. All right. I guess next, we probably ought to talk about how we go about doing this, if this is the direction we're going.
Well, I'd like to ask, I guess, Dr. Seven some questions, just, and I hate to be devil's advocate, but
No, please.
I feel pretty, I'm pretty sincere with what I'm saying. I'm not trying to be disrespectful, but
No.
you guys are medical professionals, I understand completely, but you've also been trained to wear a mask, and you haven't touched your face once this entire time.
Right.
Because I'm a people watcher. But there's a lot of people out there, and especially a lot of people on this, not counting people in this room, that are exact opposites.
Right.
That they're gonna be required to wear a mask.
Yeah.
That they're not gonna respect the hygiene component of it.
No,
They're gonna be sharing masks with family members, and more scary is kids. Because if I have to have a mask on to go to the liquor store tonight, I'm gonna take my kid's mask, I'm gonna wear it.
no.
And I'm not saying, it's not as easy as everyone being prepared to do the right thing, because people are not trained for this. It's out of their norm.
So we had, you're absolutely right, right? I'll tell you, we're not looking for perfect, right? We're not looking for perfect. We're looking for better, right? And while the persons that aren't typically in masks may touch their face, using good mitigation strategies like hand washing that we do when you come in and out of any place, or hand sanitizer, offsets that, right? I got a gallon at one of the local stores of hand sanitizer recently, so we can refill all of our jugs. It smells terrible. I stopped putting my hands near my face. It's just a lucky byproduct of a flower smell that I don't like, but I say that because people will get used to that, right? We have norms every day that we do, we don't think about. And it's because we've taught and learned and did over time. And with mask wearing, I think that will happen as well. We're not looking for perfect, but if 90% of the public or 60% of the public does it right, you'll have a significant reduction in cases in the county.
And my other one, not just my other, but a couple issues, you know, you get a sense of security, because my parents are the best example. But if I have my mask on, I can go to Home Depot.
Right.
No, you need to stay away. I mean, and I don't want people to have a false sense of security that wearing a mask absolutely saves you, because I disagree with that 100% on a scientific note. You know, having something over your face definitely probably helps,
Right.
but to say you're safe is completely different. And some of the, you know, the exceptions and things like that are written in this deal are not common sense to me. You know, wearing it to sit there and wait to get in the restaurant and then take it off and be around, I know, social distancing in a closed space with a bunch of people does not necessarily protect you, but since it makes you feel safe, that's okay.
Sure.
And
so in that case specifically, and I was at a local restaurant last night, I look at the verses, right? All the employees were wearing their masks. Our booths were separated, and so we had greater than 6 feet. My wife and I were able to have a meal. And the versus versus the employees not wearing the mask, higher risk. People that that may be ill right next to me, higher risk. Using menus that they don't wipe down after every patient or every patron, higher risk, right? The public understands that if they're sick, they probably shouldn't go, although there may still be some, but a lot more are not, right? And so that reduces the risk. And so, again, the enemy of good is perfect, and we can destroy a system trying to get to perfect, right? What we want to do is get to better, right? And if you look at the verses and all of those scenarios that you brought up, the verses of not doing anything significantly increases.
Well, I'm
the
not
risk.
saying not doing anything, but I think people have a choice.
And
And that's where it comes down to, because the
I-
versus on me is, do we promote population dispersal where people are going to go out of state and out of county to do items because there are no restrictions, and they're in a higher risk because they're not around the normal people, and they bring it back.
Right.
And they bring back a different strain that right now we're having fairly good results with. No one's dying, thank God. It seems like they're going through the hospital at an easy rate. I'm not trying to be mean. I'm just trying to air out everything that all of us have heard this. So I'm just trying to be the voice to put that out there.
These are excellent, examples of concerns that I want to address, because I want people to understand kind of what this does for them, and also maybe what it doesn't do, right? We all take a risk every time we walk out our front door, or let somebody in our front door, right? Even our own family, who we don't know where have been. And so we're trying to mitigate we're mitigating at every thought process, right? We're doing risk awareness and risk reduction, or risk acceptance at every thought process. Now, we're not mandating masks like we mandate driver's license, right? We mandate driver's license because we want to make sure the person behind the wheel understands how to use that vehicle, so they don't kill somebody, right?
Right.
We all have limitations on our liberty for the things that we do. You can't drink and drive. You can do it, but you'll go to jail because you could kill somebody. You can't drive without a driver's license because people that don't know how to drive can kill somebody. Those impact our day-to-day rights. That's what this is. And it has the same minimal impact on our life that a driver's license does, right? You have to put it in your pocket. You have to carry it. That's the law. A mask, putting it on, just decreases the risk of harming somebody else, including yourself, right? Now, mask has two things that we look for. One, for the asymptomatic carriers who don't know that they have COVID-19 and are out in public. This helps prevent them from spreading it to somebody else. You're protecting other people. And yes, it does have an impact on you for two reasons. One, if you're wearing the mask yourself, you are less likely to get the droplets in. Maybe not as, definitely not as good as the N95 or the respirator mask, but there is some protection. And the other thing it does is it keeps you from putting your fingers in your mouth or other places on your face. Or it helps remind you, so it decreases that number. And so minimal impact on what we do, significant impact on risk reduction, in my opinion, in our opinion. And KDHE and CDC opinion, right? We're not, making this science up. This is coming from a place of a lot of smart people that are working through this. But I understand where you're going. I appreciate the questions because we need to get that information out. And we're in a country where we have personal freedoms and liberties, and people have the right to make poor decisions or good decisions. And I'm just trying to, as a health officer, and we as a health department are just trying to get the information out we know that can help protect people in the public.
Perfect, no, but step in the right direction for damn
Right.
sure.
Okay.
Any other?
No, I mean, yes, but,
Well,
I mean, really, and I'll just, before we move on, we have no intentions of enforcing this.
right.
So it's going to strictly be do whatever you want, however you want. I'd hate to see a separation, or I'd hate to see someone out there right now that's wearing a mask not wear a mask tomorrow just because they're being told to.
Right.
And I think that's going to happen because it's going to be a fence between two people. And now, you know what? You're telling me to wear it. I'm not going to wear it
Sure.
because I was told to. When every business right now has the right to do exactly what this order says. If you want, make your employees wear it, make everybody wear it. Do, however you want to do it, you have that right. And every person has their right to wear one or not. With the enforcement piece out of it,
Yeah. I'll tell you,
it just, what's the point
from the
when?
enforcement side, here's what I would say. You're right. I don't think the sheriff is intending on going out and writing tickets. In fact, I'm sure he's not. But I will tell you, if you have an outbreak in your company, we're going to shut you down. That's simple.
No, I agree, yeah.
Right? And so there is enforcement in that if you aren't protecting your business or, if you're not protecting your business and you get an outbreak, you will see us knocking on your door, right? And so there is an enforcement piece to this. Now, I don't want to shut anybody down. That's not what we're here
I agree.
for. What we're here for is to protect the public and every business in our community so that we don't have this issue. And so one of the first questions I got when this order came out was, how do we respond if somebody wants to come into our business without a mask? And my response is, it's your business. And if you want to protect it and you say you need to wear a mask to come into this business, I will support you. And I will. Right?
No,
Because that's the right thing.
100% agree with that.
And so that's where our enforcement piece is, right? The local businesses protecting their company. And we have businesses that are $1 million a day business around here, right? Huge money, huge impact on the number of people working for them, right? We're not talking, 1 or 2 employees, also very important, but you could take out an organization with 300 to 500 people, that's huge. And we don't want to do that. Protect your business. And my personal is if asked, I will support that. And I do support that. You guys too? I'm putting them on the spot right here. But
Which we've already had some
You're-
businesses
yeah.
with cases, and they maybe only have 2 or 3 in their employees maybe that are sick, but it's already impacting their ability to even operate. I mean, just like if you take if you took 2 or 3 EPI nurses out of the health department, I'd be like, whoa, we can't operate like that. So at least, you know, I don't know if any of your kids have ever sneezed while you're eating supper or anything. You're like, like it comes at your plate, you know, and it's like, bam. So if I've got this on, at least if I sneeze and I don't act quick enough, this is just gonna go right in my mask. You know, it's not 100%, but it's not gonna go bam out into this. You've ever seen that video, you know, of the sneeze or the cough. So we already have businesses, a few struggling because they're taking it very seriously now because they just have 2 or 3 people and they're already seeing an impact. So,
Right, and I think they need to take it seriously. I'm not
yeah.
Sure.
devaluing that, but I don't want this to turn into the exception situation that we've dealt with this whole time.
Yeah.
You know, I've got this business, can I do this? Can I not do this? Because it just, when you start taking exceptions out
Yeah.
and making where, and I completely agree with the athletics, because I watched a football camp yesterday where they're wearing masks. I think that's
No, and
a terrible idea. However, where do you, it's going to be so many lines drawn across this that really what comes down to is that businesses have to make the right choice for their business. Families have to make the right choice for their family. And I want to have them, I want them to have the availability of making that right choice.
Sure.
Without being told to, because I think
Right.
there'll be people that'll just buck the system because it's the system.
And for
And
your
that's-
guys' part, for the health board, if you were just to say, we strongly recommend that you follow the masking,
I believe in that.
I'm okay with that.
I recommend, I think it's, for certain individuals, I have asthma, it's probably not the best thing for me.
Right.
But, I mean, I'm borderline heat stroking every day. Throw one of those on me, I will.
The opposite-
Recommendations is a lot different
Yeah.
than an order.
I
An order for me is enforcement.
Right. The only enforcement piece, like I say, that will come about is if a business has an outbreak, we will be there. And
Well,
so
with the-
we're gonna enforce issues with
Because with the
that.
quarantine and isolation, you have to.
Right.
That's a given.
And so, again, I'm not asking the sheriff's departments or the police departments to go out and, you know, issue citations for non-mask wearing.
Nor am I.
Right.
I'm just, but that's,
But what I do want is, I want you guys to clearly say, we highly recommend the use of masks, hand sanitization, and social distancing as outlined in the order, right? Because it is good science and it's good, it's good risk management to do those things. And it will,
Dr. Stebbins and I all along have wanted you and the community to understand the why, and that it's
Right.
not an order, and that you just have to follow blindly, but that there is reason behind it. And when used in the right settings, can help. That doesn't necessarily mean football camp, but definitely when used in the right setting and the medical reason why.
Right.
Not just because.
I have had a few businesses already call the health department saying, I'm glad that this is there because it gives them a little bit of teeth to say it's an executive order from the state, we have to follow it, whereas if there isn't that, then some of their patrons, I think that they feel like, well, you're just making us do it, so I'm gonna go to a different grocery store or whatever, but
I know, but
it
from
gives them a little
the,
teeth.
from the beginning though, when they were being asked to be closed down, it was because they didn't want to do the right thing and close
I
their
know.
business because another one was going to steal it. We're in that same boat now because the counties around us are opting out or however they're dealing, stay out on what the other states are doing necessarily. We're in that same position.
Well, I don't
And
know,
it-
some
next-
businesses are fearful now that we have more numbers, you know, they're a little fearful that
Right.
they could have an outbreak.
And I live in this community, my family lives here, my friends live here. I shop here, I eat here, I work here. I'm not seeing a significant slowdown in business out there, right? I'm not seeing a lot of people not going, I can't even hardly get into the Home Depot parking lot, right?
Right.
They're still there.
So I think by and large, people are still staying here. And I think for Home Depot, or I don't want to use any specific name brand, but for any one of the businesses, to protect staying open, I think this is reasonable. And if they're asking for that, I think it's reasonable. And quite frankly, a lot of these businesses have curbside capability. You're not missing out. You're getting all the products. They're happy to bring it out to you.
Right.
And a lot of them are actually happy to deliver them right to your door. There's ways around it. We're not impacting significant liberties by asking that you wear a mask. So, you know, but people have the right to make their own choice. Strong recommendation on your part is what I would ask.
And that's kind of what we've been doing all this whole
Right.
time. There are some businesses that have adapted different models now that either sell a mask, I obviously can't afford to give them away.
Right.
And that, going back to the cleanliness thing, if everyone had the opportunity to have a clean mask and you knew it was clean, that would completely change my mindset. But
Yeah.
it is, I know people have been wearing the same one around for a month
Huh.
and haven't washed it because it's N95 and they're not going to be able to wash it. That's a health concern to me.
Sure.
But there's people adapting and letting people, you know, not saying you have to wear a mask. You come in, we sell them if you want them. If not, stay away from everybody. Try not to touch everything. I'm not saying that's the best answer, but at least it's working in the right direction.
They'll do their own risk.
Comes down to
evaluation.
everybody's got to do what they feel's best for them, you know?
But please, as the health board, strongly recommend the use of masks, hand sanitization, and social distancing in the community. Please. And that's from the doctor side of that.
No,
has to
I'm-
take care of the.
I respect your opinion. I'm not
Yeah.
trying to devalue anything. I'm just trying to air out all the conversations
I
we've all had.
Have
'Cause,
had several emails,
you know,
and yeah, and as Dr. Bean and I took over in this position and have been working with Rebecca, the first thing that we said is we want a common sense approach to this. Right? We want a common sense approach to this. We want to use the science. We want to use the current situation and common sense to dictate as what we do. And we've had a lot of cases that we have discussed and have modified because of common sense, because of the science and the current situation. All the way until 10:03 when we walked out of this room. Another discussion related to that, and that's how we want to do this.
right.
For you, for our county, for our families.
All right. Okay.
Thank you very much.
Do you have anything you'd like to add?
So, in regards to the enforcement, and just make it clear, and this is what I put on our Facebook the other day too, is, and I'm coming from the AG's memorandum that he sent out, and I just want to read this, and this is just part of this. The authorities and procedures ordinarily available to law enforcement officers to enforce criminal laws may not be used to enforce the mask order. For example, a law enforcement officer may not arrest a person for violating the mask order, nor may the officer conduct an investigative stop to enforce the mask order. And no statute authorizes a law enforcement officer to issue a citation or to take any similar action in violation of the mask order. So, as far as our part in terms of that, my job is black and white when it comes to that, and I have no choice. And so, on my Facebook page the other day, I'm not a medical professional. I gotta take this thing off, I can't breathe. I'm not a medical professional, but I encourage them to go with this order and to go with the medical professional do. I agree totally with that, but as far as enforcing that, we don't have the authority to do
No,
that.
it sounds like the only enforcement that is out there is if a company or business would see a big influx in their employees, then our health
Well,
officials
and-
would step in at that
And
point.
a lot of the talk that's going, it's a bunch of what ifs. What if this? What if that? I mean, we can what if all day long. But and the questions that we get is, once if somebody refuses to leave, listen, call us. Well, that's a whole other ballgame when your business is trying to protect your business,
and you tell somebody, I'm sorry, you can't enter this business until you have a mask, and somebody wants to buck that, call us all day long. We'll take care of that. But as far as making somebody wear a mask, that's out of my hands at this point in time. And again, we will show up if anybody's having issues like that. But when we're talking back and forth of logistics, even if you could, our courts are so backlogged right now. I mean, you can't even have court right now. So how would you? There's no model for that in the first place. And I can tell you this: we have the fair coming up and the Fourth State Farm Show still coming up. I am not having deputies. If we were we're sitting there writing tickets to patrons as they're coming in. How does that? You got people that are consuming alcohol at the fair. Hey, put your mask on. Next thing you know, even if we were doing this civilly and trying to do a civil model, how does that work out? Next thing you know, we're wrestling with some guy over a civil issue. Because that's what we would be running into, and that's what the deputies would be running into. And then we got to decide, hey, were they doing 6 foot between them? Or are we going to write a ticket here? I could have sat at the gas station a while ago and wrote 15 tickets. I don't even have enough people, enough tickets to do that. So as far as the whole criminal thing, it's a moot point in terms of that.
Right, and I think that's why our doctors recommended that we strongly recommend the use of masks and go at it on that angle, because there is no enforcement.
No, and we just want to make it clear, because people are scared.
Sure they are.
People are scared. The phone calls, and that's why I put a release out the other day, because if you don't make it clear, we're going to take 200 phone calls right before the 4th of July asking what's going to happen to me. Am I going to jail? And that's what I was running into. I was having people call, well, I don't want to go to jail, but I want to go do this. And that's not the case. And so you have to make it clear to people. They need to know what they can do and not do. But as far as this whole mask thing, the medical professionals are encouraging you to wear it. If they're saying to do that, then do it. If the order says to encourage that, I'm all about that. I'm fine with that. I don't want people to think we're not doing it just because we're not doing it, because that's not the case. And I don't know, Raina, did you have anything to add? I hate to call you on the spot.
I think the difficulty is, I sworn in at 9:05 and 15 minutes plus quarter came in place. I think the difficulty is, it is an executive order, so it is a law that should be enforced. However, on June 9th, the legislature modified the enforcement provision. And so it used to be, prior to June 9th, if an individual violated an executive order under the Emergency Act, that was a Class A misdemeanor punishable by a year in jail and $250,000 fine. In June, that was modified and taken back, and so now it is a civil procedure akin to a public nuisance. And so the penalty is to file a civil lawsuit and subject the individual to up to $2,500 in fines. As Danny indicated, at this point, my priority is trying to get victims back into court, and so they can have accountability. The order, as I read it, indicates that this board can make a more restrictive finding. I know that the city of Parsons has done that. They have made a city ordinance which requires mask usage, and they have a 3-pronged step, basically: verbal warning, written warning, $10 fine, and then it becomes a crime. And so they have a graduated, and I think by doing that, they're probably trying to educate the public that this is what we need to do. At this point, Danny's right. I've read, and I'm sure that Jim has as well, the opinion from the Attorney General of the state of Kansas, and basically it's taken the enforcement piece out. And so the only way that we can enforce it is by filing civil suits, but in order for me to be able to do that, I'm going to have, it's kind of a catch-22, because in order for me to file a civil lawsuit, I'm going to have an affidavit from law enforcement or former citizens saying they want this person charged or held accountable. Clearly, if someone violates, businesses have an absolute right to have a mask policy, and as Sheriff indicated, if someone does not abide by that, I certainly will prosecute them for no trespass, and for a public nuisance if they are disorderly or what have you. But I think that between the change of law in June and the Attorney General's opinion, I think it makes enforceability really difficult unless the commission enacts a countywide ordinance that gives my office a little more teeth to go after it. But I certainly will, I mean, if you want to have an executive session and discuss it, your meeting's running long, but I'd welcome your comments and your input, and we'll do what I can to help protect the folks of Crawford County.
Thank you.
Appreciate your time. Thank you, Sheriff.
Any other questions?
Does anyone else? Jim?
Okay, I just want to make sure legally that if we're going to do what I think we may be doing, that we do it the right way.
Thank you.
So let me hand this out again. This is the House bill. The new House bill, which gave counties the ability to start at
Number 1.
H, where the Board of County Commissioners may issue an order relating to public health that includes provisions that are less stringent than the provisions of an executive order effective statewide issued by a governor. So I've been following what other counties are doing. And if you want to do something that is less restrictive than what the governor set out, we'd have to issue an order based on findings that we've heard already from our health officer, deputy health officer, and then based on findings from the commissioners. That would basically be an order stating that we strongly recommend and encourage the use of masks, but that it would not be, but we would not be following the governor's order. So I want to put that out there, that if that's what we're looking at doing, we would need to actually draft an order to that effect.
Okay, so the other counties that are opting out, what are they doing?
They've drafted an order.
So it's similar.
I've seen some samples that we could use.
So on this, there is reasonable exceptions on this. There is reasonable understanding on how and where it's to be used. You know, if the recommendation is to follow the order, strongly recommend you follow the order. It doesn't necessarily have the law enforcement piece, which really isn't there in the first place, right?
Right.
But that is, you agree with those recommendations, and we strongly encourage the public to follow those. I think that's a reasonable option, and it doesn't really change anything. Now, this is legal stuff. Doesn't really change anything. The only thing that we're not saying is that with regard to enforcement, but again, that's not really there. The businesses in our community need something that they can utilize, and that has a lot of aspects there that the businesses will have employees masked and patrons masked. They need to have something that when somebody comes into the business and they call, if they don't comply with that, to say, if they're wanting to come in and they say, you can't come in without a mask, and then there's a big stink and they try to get them to leave and they don't, and a trespass issue comes up, or whatever that you guys would do, the businesses need to have something that they can fall back on. And I don't know legally.
Does the
that
business
part.
not have the right to do that already?
Sure. But
I
I
mean,
think what we could do.
The only thing I see for clarity's sake in Crawford County right now is if you have a business that's 100% require mask use, it would be really nice if I knew that before I went to that business. And that agitation wouldn't be there from someone that's saying, I'm going to go there, I drive an hour, and you're not going to let me in because I don't have a mask. That's when you have an issue. If I know you require it, then I either go somewhere else or I put a mask on. It's simple. But I don't know how we could
Right.
put all that verbiage into an order for all those situations.
That's
why.
Yeah,
And that's
I
why
see
you
what you're saying
recommend the
now.
governor's
It's all
order.
there. It's
Right.
And then you
So,
don't have to do
okay.
anything other than saying,
Okay.
you know, you're saying, we recommend that this is a good policy. And you're not saying that you're going to enforce anything. I think it's been clearly stated.
But the enforcement piece comes when a business requires that and refuses you business. That's where you're gonna have to deal with some stuff. And that's just a,
And I don't know if that's gonna happen. That's just what is.
right. I think it
I
would,
don't know that it's a big.
I think it would curtail if, as long as you know they require them, you have the choice if you go or don't go.
And just to interject, I know that the city of Pittsburgh, I know that they issued a similar press release that indicated that, that they share view that they're not going to be ticketing people for not having, sorry.
No, it's a pillar's in the perfect location.
I'm not trying to avoid you.
Yeah.
But they had issued a press release that indicated that businesses called and they said, you know, they're encouraging businesses to do that and that they also would enforce the no trespass. So I don't know if businesses are putting signs up, I see a few, and so.
It'd be helpful.
Right.
Can I add something?
Yes.
'Cause I'm on that COVID recovery response task force, and we're developing a pledge for businesses to take, and then they will be on the website whenever it gets up. They will have signs in their doors, in their windows, to say this is a safe place, this is the pledge that we've taken, and we're kind of following what Lawrence has done as far as that pledge, about masking, about hand washing. So we're in that development right now. So that'll be something that will give people a list on, these are the businesses that are requiring masks. These are the businesses that are safe.
Okay. Sorry, Jim.
It's all right. So I think where we're at is we retain the language of the order, but it's going to be a strongly recommended that businesses and individuals encourage mask wearing, that the enforcement is not criminal. At the very least, there could be a civil fine, but that's highly unlikely unless we find just somebody deliberate violation, we have issues. So I think that's where we sit. I'm good with leaving it that way then, and not going through with trying to write up something separate.
I think that's spot on.
That's where we're at. Otherwise, we would have to draft up an order with all of those strongly encouraged with exceptions and things like that.
Good?
I don't know. I'd like to see another order that you're talking about,
Okay,
if that's a possibility.
okay.
Just
All right.
even in a neighboring county. I'm just, because I obviously didn't look and see what those
I'll see what I can find.
orders look like, but I 100% agree. Strongly recommend business have the right to require masks if that's how they so choose.
Yeah, I agree that with, our healthcare professionals, if this is what they strongly recommend, I am 100% behind them. We're fortunate to have the healthcare professionals that we have to lead us through this. And I'm 100% behind whatever decision they recommend to this commission. If you'd like to look at, neighboring counties,
I'm just curious how the verbiage changes. If it's similar to what we're saying or if it's completely different.
Some have basically said, we're not going to have, the order is we're not going to have an order. I think some counties have just passed a resolution to not have it.
I've seen a few from other counties, already.
Okay, maybe we can look at that.
I can forward you some of them.
All right. Want to look at that for Friday's meeting then?
We can-
And we'll just.
Whenever, I mean, I'm
Well,
not,
if we wait till Friday, then the governor's order's in place anyway right now, correct?
Yes.
So they're basically,
So we want to recess for a little bit and see what we can find out?
do you want to do that?
we can do that. I mean, what simplifies your life, Sheriff? Not, it doesn't change you either way, does it? I mean, I just want to be very careful on the verbiage and what's it, I understand the process of what we're looking at here. It's just,
Well, and if we move forward on this today to go with our doctor's recommendations, that's not to say that by Friday, if we see something that, you know, appeals to us in a better fashion, that we can't change it. But, and if you know, if we wanted to take a recess and do that, I'm A-okay with that too.
does anyone else have anything to add? And I know I didn't want to overlook anyone, but.
You know,
Well, we can take a recess and see what we can dig up real quick.
I'm fine with that.
10 minutes, 15
Yeah.
minutes.
Okay, go into recess for 15 minutes. What time would that be? 41?
Yeah.
11:41?
Jim, we already have
Depends on
some.
what clock you're looking at.
Yeah, which clock you're looking at?
Show you where it's on.
Yes, I believe that our, understand, Jim should have it over across the hall. Yeah.
Sorry, I got sidetracked a little bit on it. You just need one? Jim, take grab. Sign. I apologize.
Good for you. Risk management, risk mitigation.
I tell you what, the pins at the front of the convenience stores.
Yeah.
that would be director kind of communications to link different communications with all of the entities within the county, businesses, healthcare, with the same messaging and push the messaging out to the public in a more organized, consistent manner. Yeah, so we're wanting to get 2 of the rapid testing machines for Crawford County. One would be placed at the Christie Hospital Lab, and the other would be placed at the Community Hospital Lab. So those are tests, it's a machine that's able to run the COVID-19 test, and it would just be available to us in a much quicker amount of time. At this point, we're sending those to either the state lab or labs outside. Different ones, there's several different ones that we send to commercial laboratories, and it just is taking several days, sometimes 5, 6 days. We would like to turn around within the same day, and it would take a minute. Yes, so they agree that. Yeah, we'll have to advertise, and ordering the lab machine, the actual rapid testing machine, that will take some time. So we have to get that from the company, and I don't have time frame on that. But we'll be working with the Christie Lab to get that all done. So the machine is $32,000, and we're wanting to get 2, and then also testing equipment on top of that. From Spark funding, not from the general county fund, but Spark or grant funding. Yes, that's the money coming to all of the Kansas counties. Each Kansas county is getting a lot of help. Thank you. Yeah. Sure. Okay.
In 8 days.
Sure.
But I'm going to a town that has my odds of getting COVID.
Yeah.
Probably have twice what they are
Florida is on the list. Yeah. Yeah.
But we're going private beach, private residence, and I'm like, it doesn't help me because I'm retired.
Sure.
It feels my husband. We're about to be back. So is there, depending on where you're going in Florida, we're not going.
They do not delineate that right now at KPHE, unfortunately, because I get that, like, there's some Kansas counties that just have zero, like, you can go to those counties. It's reasonable to say that there is some people, but KPHE is not delineating counties right now. You know, in the beginning, they did with Colorado, remember they had those specific counties, but they are not doing that.
And it's like silent, like, I was out.
So he would not be issued a quarantine order.
We do not, it is not mandated for us to issue travel, for travel. The health department does not have to issue quarantine orders, so for travel, that is not mandated. They are still expected to quarantine. Now, part of that has always been given to us by KDHD is that can be given like to the health officer to see if there could be modifications, like an N95 mask, or if the person's gonna go to work and there's literally no one else there. We have made, like, when this whole thing first started in Colorado was on the list, in California, we made, I as the health officer made exceptions. A person worked in a facility all by themselves at night, and then as long as they wore the N95 mask and they were there by themselves, I was fine with that. And then they were at home.
So then technically, because my husband works for the state.
Oh, that's the, okay.
And he's in an office, 2 other people, but they're like, one's here, one over in this office, I don't know.
So since Dr. Bean and Dr. Stepper are the health officers now, that.
No, I haven't got any, haven't seen any emails coming in.
It's the business is okay. This person I work with owned it. They had employees, but they were never going to be around.
I don't know if this is yours,
Yes,
because I
that
don't
would be
know if
something
it
they have to
was
also.
going in and out with.
And stay aware that, hey.
Yeah,
and
it's
it's all- Travel is not required. So that's kind of, we're talking about the travel quarantine, it's very similar. It's not like a contact is required.
It's time.
It's time?
It is time, I think, it wasn't 11:20, I think it's 11:22.
Not necessarily, no.
Well, microphone channel thing.
You did?
Yeah, no, I didn't. Just wanted to tell you how I feel.
I know how you feel.
Jack. You remember, I was thinking about him last night, we were talking back, Ladon and I know. And that, RJ got that storage, got Danny and them.
I was there on Sunday, so I was in
Wanted to drill bad and fit on it and stuff. Anyway, he came up, got all pissy and a couple of meetings about it, you know, Jack he was mad, so, and he put that chain link fence, like 10 foot behind that building, there's a big overhead door in the back, they couldn't get in. I remember that things. I had some fencing, this guy. You know, Jack.
I'm gonna miss old Jack.
I just laughed. I
He
couldn't
was a
believe
good
he
guy.
did that. He was like, he came to
Do you know Jack Coombs, man? Do you know Jack Coombs?
Which Kim's?
Jack?
Yeah.
He died.
No, that's a shame. Just retired now. He's,
Yeah, died 2 nights ago.
there's been a bunch of them lately.
Don Pappas, Jack, Lisa Locke.
his second 60th birthday party, they had one.
Yeah.
Realized it was, he wasn't 60.
Reading or not reading it.
Think of the nurses in the hospital where they had N95s all day. It was supposed to watch. I've been there.
trying to do the right thing, but they don't realize it's counterproductive. Yeah, I just think they're trying to do that. Everybody's just trying to do the right thing. That's, so there's a lot of gray area. And I think it's happening in other places too. It's just, that's what I heard, it's just. All right, Tom, you getting Jeremy? Do what? So I think we're time.
I know, wouldn't that be great? Yes. I'm old school still because I have to look at stuff.
What was the COVID CBDG? That's it. See where we're at on that.
Yeah.
Yeah, 12:30, I do have it written down, 12:30.
Okay, I guess we'll call the meeting back to order. Where's Jim at? He's back there.
Jim?
Look, yeah, that's right. And looking at some, they were kind of random options, I guess you could say, right?
So really, the resolutions that Rebecca had, and then a couple I'd had, kind of going through the counselor's email thread, really were a full, an order just to completely, there was a recommended to wear but not follow the orders. So I think based on the advice that we've received from Rebecca and both of our health officers, I think really the message we want to send, and maybe even a motion, is for strongly recommending the use of masks, along with some of the guidelines in place to let businesses know what they're looking at and what is to be followed with the exceptions. Otherwise, we're looking at a total rewrite.
So that would be allowing the executive order to stand in Crawford County?
Unless we do a complete rewrite.
Okay.
So, to emphasize, strongly recommend the use of masks, especially when social distancing cannot be pertained, and practice social distancing, good sanitation, hand washing. Businesses will have the right to require and limit entry if they choose so. If they choose for people to wear masks, that's in every right theirs. If they have people that refuse to abide by that, then we can enforce that in a different situation. Agreed?
Yeah, it'd be like any other situation.
Right. No, that's where it muddies, and that's,
Or I could just say the executive order still stands. I mean, I can make that short and simple.
Do you have a preference, Doctor?
Well, we could say we didn't change anything on the executive order. The recommendation of the health board is to strongly recommend masks, social distancing, and hand washing. As is in the executive order, there's not a significant enforcement piece except for trespass that any business would already have available to them. But they are following the order if they put in place these things in their businesses, and if somebody had a complaint or concern, they have the backing of the order that's still in place. And, you know, it's up to the health board and law enforcement, secondary to that, if there's gonna be any other significant enforcement piece, which there's not. And so
Right.
the public to say that they're mad about an order that we're not really harming them with, right? We're not out there pecking on their shoulder to tell them to put on a mask. The businesses may, and they have every right to. We
Right.
need to encourage and recommend that, and give them the allowance from this order to be able to do that without fear of repercussions, because they're following the state directive. I think they need that for their own peace of mind, and that's why I hate to take that away. And so Rebecca could say, they didn't change anything with the order, we're following the order as it's written, and they encourage people to wear masks. I think that's,
I just would like to be unified message because we'll all get calls. We'll
right,
all
so,
get calls.
but, so let me jump the other side of the fence here for just 2 seconds. If we opted out, do those businesses not still have the right to follow this order?
I think we're setting the wrong precedence if we opt out, especially in a county with 278 cases and growing.
I got a
Right.
text that we have 4 more plus the 3 back to me, so that's 7 today.
So, you know, we're gonna pop 300 by the end of the week.
Yes.
This is moved outside of the initial tight population to a more community-based population. And that's concerning, especially if we're sending a mixed message with regard to how we manage this. So I think our opinion would be that we strongly recommend and encourage following this. And really, the piece that you're worried about as far as, you know, I guess there's 2 pieces. One, the person that would say, I'm not gonna do it because I was told
Right.
I had to. I don't know how to fix that necessarily.
You can't.
What's that?
I said, you probably won't fix that.
But the other piece is for the businesses to say, the businesses, you know, they need to have this as backing for what they're trying to put in place. And I don't want to send a message that we don't think it's important and we didn't adopt it, right? That I think will have more adverse effect for our community than anything. To say we don't, by not adopting, we're saying we don't agree, and then that gets carried forward to mask our importance. And I think that creates more harm.
You know, and I've heard other people say, well, I'm only wearing it because they told me I had to, and then other people say, well, I'm not wearing it because they told me I had to. I mean, it's like you're never gonna make everybody happy,
This
you
is,
know?
this is again trying to get back to the perfect. We have a pretty good recommendation with some exclusions that are, I think, reasonable too. The children under 5, certainly less than 2, they shouldn't be wearing a mask. Those that are involved in sports or strenuous activity or OSHA-related activities that mask would adversely affect the person or the job. I think, you know, those are great exclusions. But the inclusion of businesses, employees, and patrons as a strong recommendation that we follow this, I think is also sets the right message and tone. And we're not, you know, we're the well stated and documented that the enforcement piece is a bit challenging, other than if a business were to have an outbreak that could adversely affect their bottom line, because they won't be able to function. And that's important too. I just don't want there to be, you know, concerns about discrimination claims or, you know, that we're, because you can't wear a mask or won't wear a mask, that we're not letting you into a business. The business needs to have something to say, look, I'm following the governor's order. And if we were to change it, they don't have that. That's my concern.
So what's our take when a business, because I know some right now, that if there's a loophole, which it's there, I'm not requiring masks, my employees are not gonna wear masks, I'm anti-mask.
If they make that decision and they get an outbreak, they will have.
No, I agree with that, but as far as the flip side of that, they make that decision and,
And there are loopholes in the executive order that things involve, you know, I have a medical condition, I can't wear a mask, and they are exempt.
right, and I'm all,
You're just saying.
I'm just saying
If
it.
they
just don't
make
do
that
it.
decision, they've made that
That's their
decision,
choice.
nobody's knocking on their door.
That's
Right,
on them.
That's their choice,
Yeah.
yeah.
So I'm at,
So that's why I'm wondering what, I mean, I understand the purpose of people that want to, but what is this really?
This also helps businesses that really want to, and they need that backing to say, listen, we're following the order.
Yep.
You know, we're supposed to be doing this.
Exactly.
It's just like people saying, I'll wear the mask because they told me to, or I won't wear the mask because they told me to.
Those
It's always
little-
gonna be two sides.
The smaller businesses that are all their own have very few employees and, you know, less impact on the community. Probably less concerning related to liability. The bigger companies, you know, as far as enforcement, when you've got a lot more people involved, I think they like to have a little backbone to do that. And we're the other side of it, right? For you guys in the enforcement side. If the business decides they're not gonna do that, if you're not knocking on their door, it really doesn't matter. So the only thing that you're doing is leaving the protection in place for the businesses that do. Because you're the only thing that would affect the businesses that don't. Right?
Right. No, that, yeah, you're right. That's exactly where we're at in this whole situation is
Right. And so.
you have people that, businesses that will, and I respect that right. They have every right to. And you have ones that are like, I can't afford to do this, I will go bankrupt. I respect that too. But they're gambling with the possibility of having an outbreak in their business. And that's-
The death of somebody that they work with.
And that's,
Or somebody that.
I mean, that's- because I hate to go back and dig back into old business, but as soon as when this first started, all we did is try to scramble backwards and figure out, okay, yeah, you have an exception because you can do it this way. You can manage social distancing, or you can
Those
do it this
initial
way.
orders were very hard to.
And we ended up making way more work out of just trying
And we
to,
have filled the calls already,
you know,
we haven't had a big problem with it. It's just, yeah, the executive order's in place. And I just told people, do your best to follow it. You know, no one's perfect. Do your best to follow it. Do the best to protect yourself. It's no different than the seatbelt law. If you don't wear your seatbelt, not every time an officer passes you, you get a ticket. You know what I'm saying?
well, and my thing on seatbelt law is,
It's like-
if I see a highway patrolman coming out, have my seatbelt on, and I try to put it on, I get in an accident putting it on. When? What if I didn't try to put it on?
But not everybody's.
You know,
gonna
it's
use it.
complicated.
Some people are gonna argue that it causes you to die if you have it on. Some people are gonna argue
That's
you're
right.
gonna live if you have
Put
it
it on
on.
when you did.
So just.
No, I agree.
Yeah. Do your best to put the
But
mask on.
that's
We
what-
really want you to.
you know,
Thank
I understand.
But-
we're talking
yeah,
about
It's true.
something that people are very passionate about on both sides,
Sure.
and they're gonna play by the rules. But to think that they're gonna play by the rules all the time is
We
asinine.
don't think that.
It's not
And
gonna,
that's
it's
why
not
we're
gonna
never
happen.
gonna get it perfect, but this will help just at least improve our odds. I don't know if you play poker, but you're gonna improve your odds a little bit by at least leaving the order there. It's there. If they choose not to do it, they're gonna hear this and know that they're not gonna get a ticket, so they may not do it.
yeah.
But at least they know that we're serious, we want it there,
that we're trying to
And
protect
you
them.
know, if a business
That's
says,
all we can
we're not
do.
gonna let you in because you're not wearing a mask, that they have some back.
Right.
And we're-
But I think they have that backing regardless.
I've
if
not
that
heard of
were-
any doing that, but, you know, it could happen, and that's their choice. And if they lose a patron, then that's their choice.
Right.
And if the business says, no, go ahead and come in, you're fine, that's their choice. You know, I think if we all have a unified message, yes, it's, the order's in place, we want you to follow it to the best of your ability, we realize nobody's gonna be perfect. And they have to make the decision after that,
Yeah.
you
All
know.
right, I agree.
Well, the harsh truth for me is the order still comes with enforcement. And
Well, which is left to
I'm,
us.
what we've talked about, I think has been a good talk. I think we're on the same page. I am not a fan of this. And I don't know if that means we make our own order to tweak it to what we need to for Crawford County. If you guys want to pass this one, then you can, but I'm just, we're making it muddier by churning it up. And I understand what you're saying, and I understand what you're saying, but, on the other flip side is you have people that are not going to take the recommendation, which is, we're saying that's fine. So why can't we just word it that way from the beginning instead of,
Which you can, as a Board of Health, provide an order. And I just wonder, maybe would it help to look at this every week and see just how the community is responding? And
because I know there's businesses that
what
have
kind
done
of
this
qualification
right now,
that-
but there's also people that are very black and white, and if you tell me to do it, I'm going to do it even though I don't want to.
Part of this-
And then there's others who are like,
Absolutely.
Part of the hard part for us is we're looking at population health versus the.
Individual.
no, I agree.
And so, and ultimately, that is what we're looking at is population health.
Right.
And so our recommendations are based on population health. If you decide to ride a mountain bike down, down a steep mountain, okay. If you, in doing that, are pulling 100,000 people with you, that's not okay.
Right.
Or 40,000, or
Right.
whatever, right? It's not okay. And so we're looking at population health, and our recommendations are based on population health.
I respect that.
And with that in mind, we would still recommend on our part that direction.
Yeah, I respect that.
And I'm just wondering if you would feel more comfortable if we revisit this every week? I mean, maybe we.
Oh, I think we'll be talking about this for the rest of the
We
year.
can talk about it forever, but
I
I
mean-
mean, I'm open to revisiting whenever you want to revisit this.
I would
I'm
think
sure
that would be perfectly
doctors
fine to
are
revisit
available.
this every couple of weeks. I mean, I don't
2
know.
weeks is kind of the incubation period for the virus, and that's how our numbers are.
We could look at numbers and see what direction they're
Yeah.
going and
Yeah.
then make a decision from there. Because I assume that's what you have done in making the recommendation to us.
Yeah, Dr. Bean, who covers with the community health system, well, we'll get you has counties that really have zero impact from COVID-19, right? So this makes no sense in that arena, other than population movement, which we know happens. And so we're looking at it from that respect too, on where we're at in this crisis in this county that we're speaking to, or for. And again, population health and risk management in mind, this works pretty well for that. In maybe 6 weeks or whatever, maybe 2 weeks.
We hope.
Yeah.
It'll be better.
This changes significantly. If we start getting, especially if we're following the Kansas reopening plan, that ASTRA plan, and we start meeting all those metrics 100%, well, we're gonna work towards getting to the 100% open phase as quick as we can. And remember, we live here too.
Right.
We're suffering the same rules that we're putting, recommending
Well,
as everybody else.
we're ahead of the game because have cases. For those counties that haven't had any cases, they're still going to deal with this some point in time. You can't convince me that's not going to happen.
Educated guesses, yes.
Yeah.
So,
Well, I think we're an example of how if it gets into the right environment and the right population, how it can explode in the community. It's been a long time without
Yeah, I thought we were
any significant
on top of
crisis,
it.
and that can happen. And, our hope is that we won't see a huge strain on the healthcare environment, and then we can, look at this differently. But,
did you expect to see exponential growth at the plant infection? Is that kind of,
By looking at the other plants, yes.
That's what I thought, too.
I mean, ours is not as bad as theirs.
And that's exactly why we instituted, because, we've got questions. You have more positives because you started testing more. I think we were testing appropriate numbers all along to get a feel of how much we had in the community, which was not any. And, but when we saw the positives coming in from that company, knew the potential was there and started testing, it was eye-opening how many asymptomatic people there were.
Which would have gone on to become symptomatic and infect others further if we hadn't done the testing.
Right.
At that time frame. And so that's another, it was the right testing at the right time frame for the right reasons, and then the appropriate measures afterwards.
And that doesn't mean we have to test every company that has a positive, everybody.
no, I'm just saying the cases, looking back, felt like they should have not doubled it, but some exponential growth throughout that, from that start.
So.
And it hasn't really done that. I know we got way more cases, but
No, but it will, and it was proven to have doubling rate every few days without implementation of mitigation factors.
okay.
And that's mask, social distancing, and
Isolation and-
sanitation, yeah. And then, quarantine and isolation. We know that it clearly doubles every 3 days.
Unrestricted.
If it's left unrestrained. The stay-at-home order early on slowed this way down, which was great, because we got to build 100,000 ventilators and get the medical systems and health departments ready. That gave us a couple months, which was huge for the medical impact. Because if this would have happened beforehand, even in our community, a whole different case, whole different level of impact. And now we have in place to reduce our doubling time from, 3 days to 11 or 14 or, 21 or 30, right? That we can deal with. That's the flu,
Right.
right? Now, this is a virus that kills people, so is the flu. And, that's unfortunately the fact of life, but what we're trying to do is reduce the number in both arenas, right? Flu vaccinations, that's why we do that. Without that, the 20,000 deaths a year that we have in the United States would be hundreds of thousands.
And it's important too, I think people don't realize when we say flatten the curve, it doesn't reduce the cases, the amount of cases.
No, I agree
It
with
just
that, yeah.
reduces how
The
long.
time in
so
which it
we're
happens.
gonna be tortured even longer, but anyway, we can make it, yeah, it's true, I mean, this whole thing's gonna last longer, but
We're
the
flattening to
hospitals,
get to
they can
the
deal with it.
vaccines
Yeah.
and to
Right.
create medical stability, decreasing impact, creating therapies or understanding therapies that are beneficial to the patient population, understanding what part we can impact the disease positively, and where, unfortunately, the impact of the disease may be irreversible. We just get a better understanding of how all of that works. And having the equipment and capability that gave us the time to do that. And so we are better. This fatality rate went from 3.5 to 1.5, maybe. Yeah, 2% we dropped. So our positives, 1% of the population is becoming positive, tested, I think is about what it is. And we have a 1% death rate of those that are positives, or 1.5%. I haven't looked at the numbers, but right around there. That's a significant impact that we had on this disease process, because we had some time to work through this. So, this is what this does. It gives us time to work through this.
Right.
Is there a motion that may go forward?
No.
It doesn't sound like, do we need to make a motion, Jim?
No, there's not a motion on the floor, and you don't have to.
We could just say we strongly agree to follow the order as presented by our health officials.
Yes.
Would you like to have a motion to state that? No? All right.
I mean, it's up to the Board of Health. If you'd like to make a motion, that'd be fine. Otherwise, no.
Mr. Chairman, what would you like?
I'm on the opposite side of the fence, and I agree with some things you're saying, but there's also complications in there, and those complications are out of our control. People having access to clean masks, people having access to hygiene in general. I'm very scared when we say everyone needs to have a mask on to do certain things, and those people don't have the adequate equipment. We're putting them in a.
And I want people to realize it doesn't have to be your traditional mask. It can even be a bandana tied around your face, just so that if you sneeze or, I mean, even talking, like I find myself spitting when I'm talking. I don't know if I just get excited, like spit comes out of your mouth. So it does not, and even the order says it only has to cover the face and mouth. I mean, I know some places might say, no, you can't lift your shirt up, but hey, if I was in close contact and I started to feel uncomfortable, I'd be like this. I would cover my face with anything I had.
Right.
So they can cut an old T-shirt and tie it around their face, and I've known lots of people who've done it. We've put how to make your own mask on the county website and the Facebook page, and then I don't know if Rusty could use some of the SMART funding to just get, for businesses to have some of these at their front door. And if a business would like them, they could just request them from the county. That way they have them, even when if this expires. I mean, I think businesses might just like to have them if their business starts to get packed, So I think people can get really creative with just using any type of covering. But maybe if we could get some masks to make available to those businesses who are like, I can't afford these masks, and then we could maybe give them to the businesses in the county that request them. We wouldn't have to give them to all, but whoever requested. Some of the smaller ones that don't maybe have the funding to get those types of things. It's up to you.
We need to look at the health department's side to help mitigate some of the concerns that he has with respect to mask or, what we need for personal safety. That's not going to be the end-all answer. We don't have the funding for our revenue nurses. We don't have the funding to mask 40,000 people.
No.
But those that are in significant need, we can talk about.
But there are organizations, like church organizations, that are making tons of these cloth masks just to give away for free. But if we are talking resources, then that needs to go through the emergency.
Yeah, I mean, because let's just be honest, there's people that can't afford to wash their clothes at home.
No, absolutely.
They're not going to wash a mask.
No, but if they do have that on, it protects you from them, even if they're.
Well, I know, but
wearing a mask
are we putting their lives at risk by telling them to wear it?
More than what they're already doing.
No, I mean, it's.
I mean, that's where it's multifaceted here. It's not cut and dry. It's complicated.
Absolutely.
And I think as healthcare providers, we both agree with you, right? With your concerns about the onesies and twosies, or tensies or hundredsies, I don't know. With those concerns. And both of our other parent organizations work every day to help that population in need. That's what we're here for. Our recommendations, though, are still based on population medicine, right?
Right.
And when we're looking for the greatest good for the greatest number of people, that serves its purpose. We do have to find out, we do have to work on ways to help those others in need, and that's through all of our organizations, through the health department, through risk Christian faith-based organizations that help the community. Those are excellent, that's an excellent idea for all of those resources to help mitigate that concern.
And that would be where a director of communication, like a main communication person would come in, because to be honest, with all my duties at the health department and all of the disease investigation, like I just wouldn't have time to organize all of that stuff. So it definitely, that's where having someone who would, that's their job, is to communicate with all these entities. How can we get masks? How can we get the word out? How can we get hand gel or whatever, you know, who needs it? Yeah, like it would be, that's where that would definitely play a large role. And
Catholic Charities.
yes, yeah.
Right, you know,
And also
Old
businesses
Pioneer.
can apply for spark money too, can't they, like for mitigation or masks and things? I'm thinking they can. If they need that type of hand gel,
Absolutely, yes,
masks,
yes.
X's or plexiglass, you know.
So we're hitting both sides of it.
Yeah.
Where you- With
Yeah.
those concerns, very, very important concerns. of mine.
Absolutely.
Population health and those that need help.
I just wish we had that person down today, because we could get started, you know, like
Right.
mitigating some of these things.
So we have decided, I guess, for myself, that we follow the doctor's recommendation. If you want that in a motion, I'll move that we follow the doctor's recommendation. That's why we hired them, to lead us through this pandemic. And if we're not gonna follow their recommendation, the hell do we have them for? So that's my take on it. That's a motion.
That's a motion.
I'll second.
And I'm still, and I respect your opinions 100%. I think we have some areas we gotta fix. And I think we can get there, what that looks like, but I have difficulty endorsing an order that we have no intentions of enforcing, and it's a free-for-all. But I do agree that we should strongly recommend people to wear masks.
And-
If a
and
business
that- and-
requires them, it should be 100% up to that business, and if you don't abide by it, they'll come
I
take
agree
care of your
with
situation.
everything you just said,
And
and that is what the doctors recommended.
so, yeah, but with the tie to this, I'm not in right now.
Okay.
And we'll revisit it more and more.
We could revisit this. I think
It's
we
complicated.
should revisit this in 2 weeks.
And I'll be the first approach. I have no intentions of wearing masks, I'll be honest with you, but if I go to a business and they require it, I will do that. Because that's their right. And likewise, if the courthouse, and we decided that it's in the best interest of the courthouse, and I'll wear it here, but it's the
probably
loopholes
something
and
we
the
need to
exemptions that
discuss.
make it muddy. But I appreciate all your time. Didn't mean to beat up on you at all, so.
And for our part, we will discuss further in all of our organizations about how to mitigate those concerns.
Well, those concerns are gonna be very important because school's right around the corner,
Yeah.
and that's where this is going to be
And,
a
you know,
different level.
And I made that motion on several thoughts. One is that we can start school in the fall, and that we can keep our businesses open by doing whatever we have to do to keep people safe. You want to talk economics? This is how we do it, because if we don't do this and our numbers continue to skyrocket, we're going to be in a shutdown again, and that's no good for anybody. So that is how I base my motion.
And schools could apply for spark money too, right, as well, if they need
Yes.
to
Yep.
get masks and things
Yeah.
like that
Yes.
for their students.
I think they're talking amongst the superintendents, they're talking together right now, try to, at least the way I understand it, consolidate a list of common needs and figure out a way to sort through the chaos. If everybody's on the same page, we can make it all work.
And we thank all of you for the very hard work that you're doing. This is not an easy process and an easy decision making. And, you know, I personally thank you for backing this, but also expressing your concerns. And I know I'm playing both sides of the street here. But it's a complicated issue. And endorsing helps us. Caveats help us too. And we appreciate, again, we appreciate the work that you're doing.
Well, likewise.
We appreciate
You're
what you
you're putting in more than you lead on, I know. So,
All right.
anything else to add to that, Michael?
I had one question just related
You
to
bet.
COVID-19, not the executive order. I just wanted to make sure that the commissioners, we had permissions, Rusty and I have permission to go forward to try to get an MOU with a motel or a hotel just for the short term?
Yes.
Okay. That sound good with
That's
you,
fine.
Rusty? All right.
And then I guess one of these days we'll pick up on what the work session was slated for. It took a,
I guess the other question
different-
I have is, when I advertise the position, of course, the epi nurses are going to be for the health department and the nurse practitioner. How would you like that ad listed for a communications director, pandemic communications director for Crawford County?
I don't know.
I
Are
can
you
have
planning
them
on
send me
doing that today?
the applications. I'll have Brianna put the ad, I'll have her send that to the newspaper. I don't know that we'll make the cutoff today. But then what usually I'll do in our ads is they'll send all the applications to the health department director, and then I could bring those to the commissioners, or I could have them emailed to Jim, or
the
however you
applications,
want.
We'll figure that out. I'm just worried about the posting. Do we need to do anything special on the posting, Jim? As far as the position?
I'd like to see it.
I could just type something up and email it to Jim, and then if he approves it, go forward with it.
The
Perfect.
communications person, they probably should come here.
Okay, yeah,
Send off the
okay.
work law.
okay. Do you want to type something up and just email it to me, and I'll have Brianna put it in the paper, or? Okay, okay.
All right. Thank you again.
So I did have a couple questions not related to the executive order, but still coronavirus, because clearly we haven't taken up enough of your time, moving into the afternoon. So what has, since you guys have been in for, has it been a couple of weeks? All time blends together and is meaningless at this point to pretty much everyone, I think. What has the communication process looked like between, because Rebecca being at the health department and kind of doing the on-the-ground stuff, and then you guys separate, what has that process played out like? What is that?
It's been good so far. Our email is set up. We've been emailing a lot. I've been fielding a lot of calls at the health department, like we talked about how we would do. And of course, many I can just answer, you know, they're not necessarily specific to health officer. The ones that are, we've communicated pretty much almost daily now, how we want to, you know, I'll ask either one of them all their thoughts, and we'll kind of come up with a coordinated plan. So far, I feel like it's gone well. We've had a three-way call before, you know, just get on our phones, three-way call.
For the more challenging decisions, Dr. Dean and I have a tendency to just call each other, irregardless of what the day is, or vacation, or location. So that we're have a concerted effort regarding what we're saying. And, you know, the good thing is between the three of us, we have some different looks at this. And so having the ability to bounce that back and forth sometimes has changed our initial decision.
Which I have thoroughly enjoyed. I mean, I will say that being able, and just their standpoint as physicians, and where they work, the ER, the clinic, I mean, for 4 months, I just only had my own knowledge to go by, and you know, what I was getting from CDC or KDHE, but this has really been excellent to be able to get a different perspective on it, you know, because sometimes you're so in deep that you can't see any place except for where you want to go, and that's not always the best thing, you know. So I appreciate this because it has been so beneficial and so much better than having to just have no one else to bounce ideas off of, really. I think it's been excellent for our county to have this resource available.
Good.
I think our communication has think there's still maybe a little bit of confusion. We both have people reach out to us, which is fine. And I don't know, I don't want to, like, not respond, and, so I don't have any more of a central repository where people can pose their questions, I think would be good. And, have.
There was some way to get like this one email or something where everybody could send to that we would all have access to.
The access point typically has been the health department, and she is kind of doing this in that she's piecing out the information as she gets it to each of us. Now that we're on the Crawford County email, that helps.
I think it was just while I was gone that week,
Yeah.
because I have put out a message like to all health department staff to send all calls to me so that I can look through them and decide, many I can just answer, they don't have to be sent to the health officer. So I think maybe that might have got a little better once I got back, and I sent out a blast to everyone, like, I just need a list of everything, and that has worked really well to this point. I guess we'll just keep adjusting it as we go. However they want to do, it's fine with me.
Your guys' standpoint, do you have concerns about communication flow between us and you, or us and the county?
No, I think you're doing a wonderful job, and we appreciate everything you've done.
I guess there has been, and I guess there are probably several factors in here since we've outsourced a lot of the caseload to KDHE that, like Rebecca had been updating us whenever there were new cases or developments with businesses or that kind of thing, and that's kind of gone
And
by.
that is very difficult to do when you're outsourcing your contact tracing, and I
Right.
think a lot will shift back once we get extra help and we're able to do all of that in-house. We'll actually be able to keep better numbers and things like that.
And we're probably a little skittish on some of the information flow because of the protected health information.
Right.
In our current positions, and good standing. And so there are, as I listened to the meeting today, there was some information that I feel like we could get you a little better that would help you, like, release from isolation. I think that's a number that benefits you.
Right.
So we can work on those kind of things. The new case numbers, hospitalizations, I think are numbers that benefit you. Direction of our case, direction of new cases benefits you, and so we can work to develop a better outlay of that information.
Yeah,
Regardless of which one of us is.
I think that would be helpful. Yeah, because right now we have the KDHE website as well, and that's kind of what I've been relying on. But anything on the ground would be very helpful.
And I guess let us know on the rapid response testing, what the
Yeah.
turnaround time is and getting that equipment. That'd be nice to know.
I did have another question because I've had like 5 people reach out to me about this. So there's a prom thing coming up on Saturday at the barn, and it sounds like it's going to be huge and probably not going to be a lot of people wearing masks. I don't know if you've heard about it or have ideas about how to proceed or what we should be doing, or if it's an after the fact kind of thing.
Actually, Rebecca had already, a month ago?
Yeah, it maybe even 2 months. They did reach out, the person that owns the barn, and they do have a mitigation plan in place. So I was gonna reach out to her again after this meeting because I didn't know how things would go today. And then I was gonna visit with Rusty about getting them a supply of masks to have. Because if they're supposed to wear a mask, some kids will have cloth masks. And I also asked that they put that out on Facebook, on their posts, that, we don't have any order against gathering sizes right now, so if they can blast out that they are going to require the kids to have a mask, and if you can provide some for those that would show up without, and they also have the proper, hand sanitizing their screening, asking the kids about fevers, illnesses. So I'm gonna reach back out to her today after this to go over all of those things.
And I am aware Columbus has similar, probably not as large, but had, put on by parents and had a similar mitigation plan. As far as I am aware, have not had any bad outcome as a result of that. So, again, and I keep saying this, but we want our kids to be able to go to prom and we want, them to do things. And so I think if it's just people partnering to do what we can, we can still hold these events and all of that.
We have kids that are probably going to be involved in this, right? And so we have personal, depth in this. We have personal peace in this, not because of the prom. We have kids that didn't get to graduate high school. That's huge, right? But the personal piece is the health and safety of those kids and the public. And so we have been talking about it. And we are, early on, we asked Rebecca to talk with those that are putting that event on to ensure that we've got mitigation strategies in place. And we're going to have the same recommendations for the
Right.
show.
We recommend they wear masks, but what they actually do is up to them.
Right.
Yeah.
But then it's also what comes after those events. So that's where it's important that if my kids are gonna go to camp and they're gonna go to the fair and so knowing that if you're gonna participate in those things, then when you go to a business, do the right thing and wear a mask afterwards. The time after those events occur is just as important as the events themselves.
Moving on. Well, thank you very much for your time today.
Thank you, guys.
And I will leave these with you.
Okay.
Just evaluate if you want to
Okay.
have that type of opportunity. I don't know who wants to take them, but just please make sure I get them back.
Okay.
Yeah, just please make sure I get them back.
We'll not lose them.
Do not lose them.
All right. Anyone else before we move on to new business? Okay. Looks like Dawn's at new business.
Want to go over the clerk's report?
That's what we're here for.
Are we good to go?
I think
Yes,
so.
thank you very much.
Thank you, guys.
Thank you. Thank you very much.
Thank you.
Yes, sir.
Are you guys taking a break anytime soon if I wanted to do an interview about the
We're still in session.
For a while. I don't know how long though, sorry.
Hardly breathe here.
Come on, Dawn, you know better.
Yeah. So we got through another month anyway, so it's time for a report on all the spending from last month. Overall, it is up quite a bit, but we've had several things impacting that. If you look at that second item I handed out there, the change in expenditures between the months, that the ambulance department paid for those heart monitors. They actually paid in June, excuse me, I mistyped that. The general fund was up a little bit, and part of that was part of the partial payment on that 911 tower, $41,000. You can see in the health department, And then the health and family and free to know, a lot of that is supplies. And then they had to do a match on the Live Well, part of that Live Well grant. The road and bridge, they're getting into asphalt season, of course, as the first batch of asphalt that they've, or first month they paid for asphalt this year. And then partial payment on that excavator out of the special bridge fund. Employee benefits was up just a little bit. There were some, I think, some people back at work. It was just a lot of small things like Social Security, pension, keeper's expense, things like that were up just a little bit. Down into the fire districts there, Fire District 2 was down actually a little bit, but they had the number of equipment repairs they paid for the previous month. Fire District 3 was up. They had their annual fire pack insurance, and they made like a contract, an annual maintenance agreement on their radios for $2,500. Fire District 4 had bought some new fire hose.
All right.
Just skip down. Mental health, their payroll was up quite a bit there at the very bottom. They brought back a lot of those furloughed employees, a lot of those items that they kind of shut down, their whatever Challenger program and the Pit Choices daycare and some of those things are operational again. So unless you have anything you want to dive into,
Nope. Looks good to me.
I ask for you guys to approve that.
Roll call vote, aye.
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 Okay. Thank you very much.
How many do you need, Don?
Just one, that's all I need, sign.
Yep. Don, do you have anything else?
Well, the only other thing was, make sure you guys saw that email on the Office of Recovery. They're gonna have a couple of webinars this week on the Spark funds. Sounds like the one on Thursday will be focused primarily on our record keeping and getting, submitting things for reimbursement to the Spark Committee, taking care of the finances on that. And then the one on Friday, which is right at 10 o'clock when our meeting starts, it's more about kind of some examples of some things that some of the entities might look at as far as some of the direct funding projects, things like that. They're talking about housing resources and Department of Agriculture. We're going to have kind of presentations on some ideas they have for things that they might work in some counties. That they probably not it's not going to work everywhere probably, but to kind of get us thinking about some things that might be good, projects if the money goes that far. We'll see how far that's going. But anyway, we'll be definitely watching the one on Thursday, the one on Friday. Of course, they're taping those two. We could go back and watch them later on the website. So
All right.
that's all I have.
Thank you.
The only thing I had is that, actually, it's on the future business, but we do have Ryan Insurance Friday.
Okay.
to 9 o'clock for a work session.
9?
Where we'll get them
9 o'clock.
rescheduled, and they'll go through our quarterly loss runs.
Is that when we have the fence viewing? Is that Friday as well?
The fence viewing, I need to talk about it too. I had a call from Ron Albertini yesterday, and due to some personal reasons that he told me, but not really gonna say here,
Okay.
he is not going to be available. And he thought we could go, but I really think he should be there. He's been out at this, he's been there a few times.
Right, and
He's
that's the
drawn it
reason why
up.
we should have him there.
Yes, yes, if there's an issue about this or that, or a location piece.
So we're gonna reschedule that?
So
I
that
think
has
we
to
should
be
reschedule,
rescheduled.
is the bottom line on that. So I'll work with both parties, and we'll try to get a date set up.
Try to get that as soon as possible.
Yes.
This has lingered on way too long.
Way too long, so yeah, we'll try to get that done. Anyway, that's all I had.
Okay. Tom?
I might bring up this, the task force, advisory task force. I'd like to see a list of who's on that.
I actually sent that list to Dawn. I had it forwarded to me this
Perfect.
morning.
If you could send that to us, Dawn, that would be great, because
You want me to just, okay, I can forward that out.
I'll just forward it to, I'm sure Bruce wants
Yep.
to know as well.
I can check it out.
Like I said, we kind of all need to be on the same page here, and I was caught off guard when I was asked about it last Wednesday. So, yeah, that would be perfect if we could get that to us. I appreciate that. Thank you. And that's all I have under new business.
All right. Jeremy?
I do not have any new business.
I can't, I don't have anything right now. All right, old business, Dawn.
I don't have anything at this time, thank you.
Jim? Tom?
The CDBG CV grant, where are we at on that, Jim?
Actually, the same place we were at the last meeting. I do need to get a hold of Frontenac, and basically it's their decision.
Right.
So I'm planning on doing that today.
Okay,
I'll
I've
get-
had several businesses call and wanting to know where we're at on it, and
Right. So,
I really didn't have an answer for them, so.
yeah, that's where we're at, if they're in or they're out.
So once we do that, then the application will be available.
Committee?
Committee. We'll set up the committee.
Committee, approve the applications,
Right,
submit the
approve
applications.
all the packets, and then we'll get everything out to get started, so.
Okay.
So
it-
what's
It
the-
hinges on
sorry.
Frontenac, really, if they want it. or-
Committee-wise, what do we need to do to get that started?
We have an application process.
Single.
uh,
We've gotten one so far.
I think we have one
Wow.
that's interested, so we will try to get that out. Once we know where we're at, we'll try and get that out, publicized, and work on getting committee members, if there's people you know that might be interested.
I would say if we don't have enough committee members by a certain time, then maybe it should fall back on us.
Probably gonna have to.
I mean, I would hope we would get enough interest to fulfill a committee.
Right.
But
Right.
if not, then ultimately lies with us.
True.
I sent that all to all the city clerks about
You did?
2
Good,
weeks
okay.
ago.
Good.
That should, if that doesn't drum it up, I don't know
We
what
got
will.
one dog out of that so far, that's.
Well, good job, Dawn, you got one.
We live in Bourbon County.
Yeah.
That's all, Mr. Chair.
Okay. Jeremy?
Okay, so the task force had met several times last week and again yesterday, kind of hammering out a set of recommendations for process going forward. And so there were really a couple of them that I sent to Dawn's email. So the first one was an allocation proposal of like the number breakdown across the entities in the county. And then the second one was for hiring a consultant to manage, just because the scale of the number of applications that we will be getting for all of this stuff is going to be enormous, and having a infrastructure in place for it is going to be important. And I think I sent it before the meeting started. thought it was around 9 or 9:30 maybe.
Jeremy, they are aware that it is an advisory.
Correct, yes. I've made clear to them that the county is the,
When you want that.
if you want to do the allocations bit first, that would be fine.
Oh, jeez.
Okay. Is there any way you could maybe blow that up? Okay, yeah, that's the main part, because it's just notes on the other side. So they had recommended, so there are really a couple of options, actually, and so there are tabs down at the bottom, option 1 and option 2. So option 1 was, they wanted to have business, like economic development, business recovery stuff as part of this, having businesses be able to apply for funding locally. And so the first option basically set more money into the amount that cities would get, and then it would be up to the cities to pass the money along or set up some, the understanding would be the cities would use at least half of the amount that they receive for the purpose of business grants or
So
nonprofit
we're
grants.
looking at just divvying up the proceeds by population?
Correct. It was purely based on population for both the cities and the school districts. And so the school districts are down below, and they had $1 million set aside for that, and the amounts, again, based on the population. And then they had included the interlocal as a separate thing. There'd kind of been some discussion of whether to just include those as part of the school districts or to do them separately. And Brad Hansen, who's the assistant superintendent for USD 250, was saying that he thought it would be beneficial to give them a separate thing just because they're going to have some awareness of some of their more specific needs that the district might not be aware of. And then down below, the county projects would be the amount that the county would have to spend on, you know, the courthouse, EMS, the sheriff's department, healthcare. They kind of said that really the health department could fit either under the county projects or the healthcare, because healthcare, I think if you hover over it, there's a note on it, or maybe it appears over to the side, on the one that says healthcare, the little arrow that's, if you click on it, does it pop up? There it is. Yeah, that it would include primary care, acute care, behavioral health, and as well as home health. Just kind of covering all of the different categories. Then PSU as a separate thing from the other educational entities, child care and pre-K for things like community, or not community health, the Family Resource Center and daycare places. And then a separate, so under option one, there would be a separate small business grant program for businesses not located in one of the municipalities listed above that would have access to their own funding. So in this option, it split those out, that each city oversees its own business grant funding, and then the ones in the county would be separate to apply through the county itself. And then $1 million for collaborative projects, which is basically like if there are things that entities can think of that are going to build resilience and make it easier to respond to the pandemic now and in the future, if you don't fit under one of the other categories listed above. It's like an other, basically. And then lastly, down below, the administrative funds for the county to pay for things like the consultant, both I think the accountant as well as the program administrator, potentially the PIO position that we talked about funding. Administrative costs for us basically would come out of that one. And that actually only comes to 7.7, so there's an extra $100,000 for play within that. So Don, if you click over on the option 2 tab down at the bottom, I believe that everything else will be the same, except that so the city one in this one is way smaller. It's like 250,000 instead of the 1.75 million. And under this one, it would assume that cities are only applying for reimbursement for coronavirus related stuff. They would not be setting up like a business grant sort of thing. That would be totally separate from that fund. The school districts remain the same, but if you scroll down, then under the where is it? Oh, down below, the small business and nonprofit grant is now the 1.75 million. And so basically every for-profit or nonprofit business in the county would apply through one single portal that the consultant
This has to be
created.
tied to coronavirus expenses, correct?
Well, so there's a little bit of leeway. So it can be for individual businesses, because we're able to do a pass-through to businesses. So they could do, I believe that they're able to do like the recovery of funds lost, right? That they can do as long as it falls within the window of the March 1st to December 31st. That they would be able to cover paycheck expenses, or they could do coronavirus mitigation stuff. But I think that businesses have a bit more leeway with what they would be able to do with it, is kind of my understanding. Jim, am I getting that right?
No, that's correct. There's a section in that. The one grid sheet that we saw last week, there's a business section that they are able to use the money for. Then we also apply for money in the second round as well. But I think having that ability out there is I think we're recognizing that we're probably on our own not going to have enough projects or reimbursements to spend all the money. So if we can find a way to spend all of the money, we helping our businesses too. And that gives you an option to not have to give it back. Because I think people have already added up their reimbursements, and for a lot of places, it's not that much. So we've got to find ways to use that money locally for your risk. So I think that's what we found out pretty quick. And I think the county is in pretty good shape on reimbursement. We've already seen what some of the departments have had, countywide or more. So we may hit a pretty high number, but a lot of places won't.
It doesn't seem like the cities, that's been the case. The school districts might be a little bit different, but the municipalities were the big one that were. Because I mean, even with these reduced numbers, like Pittsburgh had said, that they get like 160,000 under this one. They're like, I don't think we're gonna even hit that. Which was why under the first option, there was the giving it to businesses rather than, because they didn't think they'd be able to spend it on stuff.
And we may get to a point where this is the first recommendation, we may get to a point where we think of other needs that we want to plug in.
Well, right now, I think,
People think about, and then we lower that.
and not to say it's the only priority, but one of the priorities right now should be the schools, because they've got to get,
Yes.
they have to be equipped to be open in less than a month.
Right.
And that should be a priority, because some of this other stuff can, I mean, I agree, there's a lot of money there, but to shortfall that is going to be detrimental just because the population they're dealing with affects everybody. Because everybody's got somebody going there.
Well, the good news is they'll have a few weeks to figure that out. If we know what they're
Are the
looking at spending, then we can maneuver some of these funds around to make it all work. If we know the schools maybe spend a little bit more just so they can open, we can factor that in, to our bottom line. It's not set in stone yet, it's not really set in stone until we turn it all in August 15th.
Okay.
But I think it gives us a good guideline. Gotta start somewhere, gotta have something on paper and moving towards the end, so.
I wonder, it made me think that we might wanna focus on getting, whatever everybody's spent already on these kind of things that they're gonna get reimbursements for. You know, I might wanna let them know, hey, you need to get those things in order, so we can get those
I agree.
taken care of, and then
See what's
where
at.
and see where that takes us, and then, but also maybe, you know, like you say, knowing that the schools are they're on a short timeline.
No, it's crunch time right now.
Right.
Say, you know, if you're gonna have proposals, we need to look at those as soon as you can, so you can.
Because really what's going to come down to, depending on how much money, there's a want list and a need list that goes with all of this.
Right.
And you definitely want to make sure the needs are addressed before the wants are addressed, or it's going to be a nightmare.
Well, I think that's where having a project administrator helps out. That's where the committee helps out, the commissioners help out. So they can kind of get everybody's input on what they'd like to see in the bottom line. Some of them might not be eligible for funding. Some of them we might just not be able to because we have to priorities on these things. So I know that's coming up next, but yeah, we do need to get on hiring.
So who do you suggest for that?
We're gonna have, Jeremy has some more information on that.
Yes, there's a second thing if you want to open the other link, Dawn, for the proposal. So it kind of sounds like we're going to have, that it's going to make sense to have two consultants, right? That one will be the accountant that would be submitting stuff to the state and getting financials in order and that kind of thing. And the second would be a program administrator that would collect the applications, work with the accountant for reporting purposes, but act as a funnel basically, so it's not the three of us that's viewing what is, I'm gonna imagine to be hundreds of applications across a huge variety, like whether it's those listed categories or other ones that we come up with. There's gonna need to be a streamlined way of addressing those, and so the proposal that they kind of laid out was a set of deliverables. Let's see. Identifying potential applicants, seeking applicants, and making recommendations to the commission. Additionally, this project administrator will work with the county-approved fiscal partner to ensure transparent and equitable processes. All activities will fall within the guidelines provided within the toolkit. And so kind of the timeline and list of activities laid out then, first setting up a timeline that lays out all of the deadlines and disbursements to all of the people looking for funds, setting up a system of requesting funds, so in the form of like an electronic form of some kind, whether a SurveyMonkey or a Google form or something that will collect all of them in a single place, so they're not like paper ones or like random emails that people have received that are all in a spreadsheet with a uniform set of information.
Telephone.
Let's see, the third bullet point, line application results spreadsheet, right, that would be available to the fiscal partner as well as us to be able to see who's applying for what and what the money is proposed to be used on, since again, we'll have the final say of where it goes. Let's see. And then after applications have started to be processed, beginning dispersal of the funds, which they would work with Jim as the point person for the county of the CARES Act funding. And then act as a primary contact for all of the people that are going to be applying for stuff, because again, there are going to be hundreds of questions of what can I apply for and all of that, and rather than flooding us, there's a person that would be managing all of that. And then ensure all data collected, analyses, presentations, and documents are available to the, so again, reporting to us will be a huge part of it, like basically at every meeting to provide updates and clarifications and to again maximize transparency. And then is there, so the recommended amounts then that they had discussed then of the 200,000, so 50 for both the project administrator or the program administrator and the accountant was what they thought would be the rough range, as well as then the additional 100,000 for like the communication and PR position and other administrative costs surrounding the getting the funds out to people.
So I visited with the national firm that we talked about last week. Sounds like there may be some local interest, which would be great as well.
Monica had said that Greenbush has a, I can't remember what it was called, a financial or research component, and they said that they thought that they would be able to handle the, if not the finance portion, certainly the project administration part of it. Which, in terms of transparency and accountability, would probably go a long way, because I don't know how likely it is for us to get a national firm here at every one of our meetings for 3 months or however long. Right,
Yeah.
which may or may not end up working out. So yeah, if we could get a local contractor to be able to do it, I think it would make it a lot easier for us.
Are there any other local contractors?
I don't know, but.
I don't know. I mean, that's,
Accounting firm or something like that, might, you know.
I know
I mean,
we're
maybe
on
someone had suggested like the community foundation would be another possibility. I don't know.
I'd like to look at Greenbush as an option. Maybe I can then call the name.
Could you do that?
Yes.
Okay.
See what services they can provide. If we could get one person, one entity doing everything, that'd be great. And then the dream is to have a setup where I can go online, you can go online and see where every piece of this $7.8 million is being spent.
Mhm.
All the applications